In the wake of the Israel-Hamas conflict, the repercussions on Gaza's healthcare sector have reached a catastrophic level, according to the World Health Organization chief, Tedros Adhanom Ghebreyesus. Speaking at an emergency board meeting on Sunday, he expressed concern about the ideal conditions for the spread of deadly diseases in the region. Addressing the 34-member board, Tedros emphasized the enormous challenges faced by the WHO in improving the situation due to the ongoing violence. A motion put forth by Afghanistan, Morocco, Qatar and Yemen is under review, demanding safe passage for medical personnel and supplies. Additionally, the motion tasks the WHO with securing funding for the reconstruction of hospitals. However, Tedros stated that meeting these requests is almost impossible given the security situation on the ground. He expressed deep regret that the United Nations Security Council failed to reach a consensus on a ceasefire with a US veto. Notably, Israel criticized the motion, asserting that it disproportionately focuses on Israel and neglects to address what it describes as Hamas's use of civilians as human shields by locating command centers and weapons inside hospitals.
But it's stating the obvious to say that the impact of the conflict on health is catastrophic. More than 17,000 people are reported to have died in Gaza, including 7,000 children. And we don't know how many are buried under the rubble of their homes. More than 46,000 injuries have been reported. 1.9 million people have been displaced, almost the entire population of the Gaza Strip, and are looking for shelter anywhere they can find it. But nowhere and no one is safe in Gaza. There are worrying signals of epidemic diseases, including bloody diarrhea and jaundice, and there have also been reports of high levels of diarrheal diseases and respiratory infections. The risk is expected to worsen with the deteriorating situation and approaching winter conditions. Gaza's health system is on its knees and collapsing. Only 14 hospitals out of the original 36 are even partially functional. As more and more people move to a smaller and smaller area, overcrowding combined with the lack of adequate food, water, shelter, and sanitation are creating the ideal conditions for disease to spread. On average, there is one shower unit for every 700 people and one toilet for every 150 people. Health needs have increased dramatically, and the capacity of the health system has been reduced to 1/3 of what it was. WHO is on the ground in Gaza, alongside our partners, to support health workers who are physically and mentally exhausted and are doing their best in unimaginable conditions. A ceasefire is the only way to truly protect and promote the health of the people of Gaza. I deeply regret that the Security Council was unable to adopt a resolution on such a ceasefire.
These emergency sessions by the WHO are rare occurrences, previously convened during health crises such as COVID-19 pandemic in 2020 and West Africa's Ebola pandemic in 2015. The current situation underscores the urgent need for international cooperation to address the humanitarian and healthcare challenges in the region.